Dr. Anita Hawk here, your chiropractic coach and mentor to help you achieve unbelievable levels of success in your own career. I had a question recently on my YouTube video about leg length and how do I check it? What do we do? So there's so many different things about leg length. So I might make another video to follow up on this with an x-ray so that will make a little more sense to you docs. But for starters, when you are seeing a patient, of course, and they're laying face down, you might want to come over. I like to have them completely relaxed. And I'll grab a hold of the ankles like this. And then the first thing I'm going to do is I'm going to use my whole body weight and just pull back. And when I do that, I'm making sure she's even on the table. Now, as you can see, if you were to look closely, it looks like her right heel is coming up definitely higher, so her right leg is coming up short. Now this doesn't mean that she necessarily has a short leg. However, we would correlate that with x-ray, which I'll give you in a separate video. But for now, just based on this, my first observation of her leg length, I might feel her calves to see is one tighter than the other, creating that lift. Secondly, of course, we're going to go to the hamstrings, checking, is there one hamstring that's tighter than the other? Does she have a history of maybe a knee injury or knee surgery or like an ACL, PCL repair, maybe on this right side, which would also cause a shortening of the leg, which would again show up on x-ray when we take a lumbar pelvic view. Second spot is you want to check, now her right leg short, that really tells me that she probably has maybe a subluxation through this right pelvic area, maybe her tailbone. Okay, so I'm going to go ahead and palpate, and I can definitely tell it's this right side is shifted up. And how you can also verify is just go right on top of the shelf of her pelvis and just see. I can see with my fingers that this right hand is a little higher than my left hand, so meaning it's definitely this pelvic area that needs to be addressed. So we're going to go ahead and address that for this patient. What I want you to do is go ahead and lay on your side with this side facing up. So the short side is the side that's going to come up, because I like to practice with kick moves, and you can definitely do a kick move even on a pelvic adjustment, except instead of my hands being on the SPs of the lumbar spine, my hand's going to actually be at the PSIS. So basically the sacroiliac joint is where I'm going to pull, okay? So I'm going to grab a hold of that SI joint. I'm going to traction it over to me. I'm going to place my leg on top. I'm going to use my leg and I'm going to pull her knee forward a little bit more, and then I'm going to thrust. I'm going to push down, kick down, and that will alleviate the pelvic area. It'll actually kind of get that pelvic bone to move up a little bit, which is what we want in this position. Let's get you on the other side. And the reason why I'm going to also have her on this side is because I know usually, and of course I'm going to correlate this with my palpation, her exam and her x-ray findings if I have them, but I know that she probably also needs an L5 move on the other side. So as I found that, I'm going to get on the SP and boom. And then what you're going to do, if you want to verify, is have them lay either on their back or on their stomach, so prone or supine, and we check the leg length. In fact, let's do that, if you wouldn't mind, getting back down. And this will let me know, hey, are we better? Are we in? Okay. In real time, you can see that there's definitely a shift, and now things are a lot more even with that adjustment. So easy way to check, easy way to demonstrate to your patients too. Hope this tip helped you. I'll be back again soon with another video.